Okay, and here we are with the How to Jimmy Show, part of the What's Up Vegas family. Don't forget to subscribe when you go on there today. My dear friend is here that I've known for many, many years since I first moved to Las Vegas, which I've told you on the show many times before. 1984, 85, I came to work for a show called Bottoms Up. The rest is history. Been doing drag along with all the other queens, and I've made a good living at it. I'm very proud. And especially today, one of my guests is no stranger to the Las Vegas community. It's Dr. Jerry Cade is here. He is a family medicine physician who lives here in Vegas for over 51 years. And of course, he's been in the medical field for 51 years. He graduated from the University of Texas at, let me get it right, University of Texas Medical Branch, 1980. And you're affiliated here with the University Medical Center, as we call UMC. That's you.
That is I.
Welcome to the show.
Thank you very much. I thank you for inviting me.
My pleasure. Dr. Cade, you have helped so many people throughout your career. But, you know, but first of all, before we get into everything, tell us what you've been up to lately. I know you're opening, and you've always got some new projects going on.
So actually, a couple of years ago now, I quit my two well-paying secure jobs at UMC to go out and hustle for money in the nonprofit world again. Excuse me.
For you. No, that's all right.
The main thing I've been doing is the medical director of the center, the LGBTQIA+ center. We started a healthcare program about 4 years ago. It was just kind of a STI check and things like PrEP, stuff like that.
Absolutely.
But about a year ago, we ratcheted it up and we were going to become a full service clinic, primary care, whatever. Right. One of the big deficits in the community, I get called all the time from people who I just moved here from Atlanta or Houston.
Wherever, exactly. Yeah.
And I'd like to have a gay doctor or a gay friendly doctor. And I've heretofore not been able to say there is one because there's occasionally comes and goes, but that's really been a big deficit. So the center wants to focus on those individuals who have been on the margins of healthcare, and we want to make sure they're well taken care of.
So your career, when you first moved here, you embraced the gay community. You got a lot of gay clients that wanted to come because they feel better seeing a gay doctor or a doctor that understands the gay lifestyle and what gay people need as opposed to what other people may or may not need. You're a legend in this town because you're one of the first people I heard of when I first moved here. And I've always thought how nice that we have our own like gay doctor. You know, you picture a drag queen, but you've done so much
we can
wonderful.
Do anything,
yeah, I'll compare you one of my weeks next time.
Okay, cool.
But what I wanted to get to was that after all those years of practicing on your own, like you said, you've branched off now and you're reaching out to the community to do this new community, center wellness.
Right.
That's wonderful. And I think that's great. I had Dr. Lucas on our last show. Lucas,
he's kind of our office manager.
Camaro. No, Lucas.
So
we'll edit that part in.
He changes his name. It's not your fault.
Oh, it sounds like, good. It sounds like me. Anyway, we'll get his last name. But of course, we were talking about you. You'll see the show. We talked a lot about you. It was all good. Cool. It was all good. But anyway, thank you for branching out and keeping all that moving. So you kind of wanted to retire, right?
Well, I'm not so sure. Everybody says that, and I'm not so sure I was interested in retiring because I think I'd be bored. But I was bored with what I was doing. It was kind of routine, and it didn't feel like we were creating anything new. Sure. We did that already, and it was stable. And I reached a point. I said, I started and ran the HIV program at UMC,
right?
And I reached a point where I said, anybody could do this. They don't need me at all. I want to go do something that we haven't got. You know? So
you actually still see patients, though.
I still see patients. I see patients more since I quit those jobs than I did before. As a matter of fact.
Wow. So, and you work out of the Center Wellness. That's
out of both. We have a clinic at 401 South Maryland Parkway, which is our first clinic. Yeah. And we just opened in June the new clinic that's on the northeast corner of Charleston and Las Vegas Boulevard.
Downtown.
Yeah. We say that we anchor the east end of the arts district.
You're kind of the arts district. I was just
We're
going to say
the east end of the arts district and right in the middle of everything.
So how does one get in touch? Just go online to the...
Just go online. We just moved. I should remember the phone number, but I don't.
All right, we'll find it. We'll put it up. Don't even worry about it. We'll have it up.
But
it's not a problem.
Yeah, but we've got 3 full-time nurse practitioners, another
Nice.
full-time doctor. We have plenty of people, and come on down.
So for someone who just moved to Vegas, like you said, from wherever they're from, needs to see a doctor or get a primary care. So you've got there's yourself.
Yes,
there's
now
other
we
doctors,
do. Yeah,
and
we
they
do.
could, I mean, you can, and what about emergencies? I mean, you
So-
always go to the emergency room if you need to.
You know, and we've actually talked about getting there. We're not there yet.
Okay.
Okay. Right now, we're trying to develop a primary care clinic, and and with a focus on
Sure.
the kind of care that has been a deficit, like transgendered care.
Right,
That's probably about
right.
30% of our patients
Yeah.
are transgendered, and so we're trying to focus on the deficits in the community. We've talked about doing emergency care. We're right downtown Las Vegas. I
Sure.
mean, we're in a perfect location to do that.
Absolutely. This is in a great spot. I want to touch real quick while I have you.
Mhm.
You've been to my shows in the past.
Lots of times.
Yeah, thank you. I just love that. I was so excited when you agreed to come on the show. I usually get performers and drag queens and piano players and stuff. I don't have many doctors come on the show, so thank you.
But I can be a drag queen or a
I
piano
thought
player.
so. Well,
I mean, can I do that?
Do you play piano?
Oh, I actually did play piano as a kid. I don't
We'll
know if
talk
I
after the
still-
show. I need a pianist.
And I did drag once. I told everybody I want to be paid, so I did it for PFLAG for
There's
a
your problem,
fundraiser.
wanting to be paid. Ask any drag queen to tell. Oh, you want to be paid? What are you, nuts?
But we raised lots of money for PFLAG.
There you go.
know.
Now you were part of all the community, all the different the AFAN,
Yeah, most of the
A's for
organizations.
Nevada,
Yeah.
the center, of course, the sisters, of
The
Perpetual.
sisters, yes. Yeah.
So you've touched on everything because you're the go-to gay doctor. Oh, we got to raise money. Call Dr. K.
That sounds just fine.
I want to touch on this real quick. My history about because I've, like so many people my age, we lost so many friends and family to the AIDS crisis. I would say the mid 80s, because that's when it really actually started before then.
So there's actually an official beginning, and that was a morbidity and mortality report from the Centers for Disease Control, and that was June 5th, 1981.
81. That's right.
It's kind of
because I was still in Houston then.
Right.
And I'll tell you, it hit the big cities. Well, it hit everywhere, but in Houston, Texas, literally within 24 months, I lost no less than 100 people, performers, friends of friends, family. It was just like devastating. And we're thinking, well, why isn't the government doing anything? What's going on? And I remember, I'm no fan, but it doesn't matter. We don't get political on this show. But I remember Ronald Reagan actually just kind of brushed it off and just kind of until finally he stepped up and started something and helped.
Yeah.
You know the dates.
Yeah, I mean, there were several things about that time, and and a lot of us are very disappointed. This is the time that they had Legionnaire's disease, and so Legionnaire's disease with 120, and of course we support veterans completely.
Of course,
but 120 veterans got tons of dollars, and they figured out what was going on in a few short weeks. President Reagan did not mention HIV until 1987.
Yeah,
6 years
I was
after
already
he was
amazed.
elected.
I remember that transitional period for myself from going from one city to another big city. And in the entertainment industry, there's so many gay people in that's no secret. You know? So I'm losing people like every day. I get a phone call. Oh, you remember so-and-so? Well, she, so-and-so. Well, he's got HIV. Today, now I wanted to mention, because it's in your long, fabulous bio, you worked with President Clinton on the Presidential Advisory Council for HIV/AIDS, and you helped author and pass the national HIV recommendations and policies to that administration.
So, it was very nice.
Good for you.
Yeah, that was thanks to Senator Reid. I mean, there were 30 of us on the National AIDS Council, and Senator Reid pushed for me and got me on there, and it was actually a great time to try to look at the epidemic nationally. And of course, we had a more sympathetic audience with President Clinton than we had with Presidents Reagan and Bush.
Sure, I have no doubt. Today, though, if you're diagnosed with HIV, it's not a death sentence anymore.
It's nothing like that. In fact, the analogy I use for my patients, some are still come in and think there is a death sentence, is you take one pill. It's easy. It has no side effects. It's more like treating high blood pressure.
Exactly.
It's more akin to treating
your blood
high blood
sugar
pressure.
intact. Your blood pressure
Actually,
intact.
diabetes is worse.
I would think so.
Than
Yeah.
HIV with all the complications. Diabetes. And that's the example I use, and I apologize to all my diabetic patients.
No, you're fine. You're in good company.
But diabetes is horrible. I mean, you have all these
hard to control.
Hard to control. You can go blind. You can get kidney failure.
Side
you
effects,
can lose parts of your legs.
And of course, 80s. Early 90s, even to today, safe sex is still the best thing to prevent
Yeah,
HIV
except we have
and
all
AIDS.
kinds of things like PrEP.
Yep.
And you know, and we did some data with the Department of Social Work at UNLV. There was this moment in history where the literature was saying 2/3 of gay men use condoms most of the time. I said, you know, I know my patients, I know my friends. That really doesn't strike me
Let
as
it out.
correct.
Let it out, doctor. Let it out.
So we did a study with the Department of Social Work, very in depth. We paid the patients. We did individual interviews. 24% at best.
That sounds good.
That made more sense to me.
That makes more sense to me because I know these people.
Yeah,
these
right.
people.
But you have PrEP now. You have you know you.
Well,
can
what
take,
is PrEP?
PrEP is pre-exposure prophylaxis. You take it on a daily basis. It's about 99.7% effective.
It's a pill or a shot?
Pill.
A pill.
There's both, as a matter of fact.
Okay.
We have both, as a matter of fact. So you can pretty much prevent HIV if you're on top of it and want to.
Well, and if you're sexually active, it just makes common sense to absolutely be prepared. You know, we had this knowledge we didn't have 25 years ago.
Yeah, and so I closed my private practice also, which was kind of older gay men with HIV. Because, and I told them HIV has become wonderfully boring. I mean, these are people with insurance and homes.
Yeah,
and they were always fine. So I switched to the center. So the average age of my practice went from about 57 to 22.
Oh, I love it.
Yeah.
Well, that's great to know. Well, listen, you've got so much going on. I can't thank you enough for coming. Come back on my show anytime. If you want to, I'll put you in drag. We can do a whole show.
You know, and you guys get paid for it. I just have to say it has to be paid.
What would your drag name be if you had a drag name?
Oh gosh, I don't know. You know, when I did the show with my partner at the time. Like one show, and we did the Celine Dion, Barbara Streisand.
Oh,
Tell Him.
Yes.
Yeah, you know, I was Barbara.
Of course you were. Of course you were.
He was Celine. Yeah, but it was fun.
We'll have to recreate that. That sounds wonderful.
Hey, we could do that.
Yeah,
I had fun. It was a great time.
I could do Winona, and you could do Barbara.
Barbara, I like Barbara.
Around.
Yeah, she's still around, and I love Barbara.
Yeah. God bless her. Thank you, Dr.
All right,
Cade, so much. Everybody, Dr. Jerry Cade, with the Center. Let me get it right. The Center of Wellness, longtime practitioner. His whole career, mostly in Vegas. And I can't thank you enough for being here. We'll be right back with another special guest. Thank you, Doctor.
All right. Thank you. Cool. All right.